We would say that perhaps on Friday and Saturday nights, 70% of the patients who come to our department have alcohol implicated in their attendance. Sometimes they will be drunk and be the victim of an assault. Sometimes a drunk person will have been the person who assaulted them. So anything we can do which reduces those numbers is hugely helpful.
We're working in partnership with Southampton City Council Community Safety Department, us as the local police and also the emergency department, specifically to reduce the number of people that end up going to the emergency department as a result of violent incidents within Southampton.
Some of the biggest opportunities come out of the data sharing that we can get with the Department of Health and the PCTs up and down the country. We've already got some really good examples of us working closely with the PCTs, sharing data, sharing information, which adds to the rich picture, which enables us to target the problem premises.
The reception staff have been great, very receptive to taking on a new challenge because they are doing the bulk of the difficult questioning and very keen to see the positive outcome of what their work has brought.
How can I help?
The data is recorded like all the other demographic data on the electronic data set the receptionists work with all the time. So it doesn't require much more time than they would normally spend booking in anyway. The data is completely anonymised, which means that people don't have any fear when they give the data that it will be used inappropriately. We've made it a high priority for the department to collect good quality data, and that involved asking the receptionists to do something which was outside what they normally did, and we needed to explain to them why that was useful.
We cannot saturate Southampton Town Centre with loads of police officers, so we need to be much more intelligence-led about where we put those policing resources.
Pick up on data quality.
We had meetings with the staff to tell them the importance of it.
Our chief receptionist will liaise with the police force about the quality of the data and what data is coming through.
What we're doing is looking at interventions with those licensed premises as a result.
The information is collated by the community safety team at the Southampton City Council, and the police force have an analyst and a researcher working on it.
What's good about this project is it is using a variety of data sets, health data sets, police data sets, to inform a process whereby we can properly analyse where the problems are in Southampton and deploy police resources accordingly.
There are two benefits really that we've seen. The first is that there's been a slow but definite decrease in the number of alcohol-related violent crime, which means that we see fewer people at difficult and busy times, which is good for the department. But the second thing is we feel our close working with the local police has really improved our working with them in other areas, of which there are many, and that's a very good thing for us and the police force.